One of the benefits that patients will experience here at McGreevy Neurohealth also has to do with patient safety. And this is something that may be a little easy to take for granted. When you come to a medical office, you automatically assume I'm in a safe environment. And what patients may or may not understand is that there's a lot that goes into preventing problems when the patient is here in the office, and also when they leave the office. So, for example, when we prescribe medication, we want to prescribe the right medication for the right patient, and we want to do our due diligence, of course, to prevent any potential harm. The same also goes for patients who may be at risk for falls. A lot of patients that come into the building have orthopedic problems, neurological problems, spine conditions, nerve conditions, brain problems, and all these things that really affect balance, affect their ability to ambulate and get from place to place while here. And so I take that seriously. I really feel like that if we can do everything that we can to prevent any issue with a patient here while in the facility or after they've left the facility, then I'm going to do that. You know, it's the right thing to do. And this has led to the voluntary accreditation by the Joint Commission, and we call them JCAHO, or the Joint Commission Accreditation for Healthcare Organizations. Very long-winded word. But the Joint Commission is the gold standard for hospital care. So we're not a hospital, but we take the job seriously here in terms of patient safety to treat it as though it were a hospital. And we do little things that ultimately are big things in order to keep the patient safe. So we have something called global alerts in our system where all of the staff members will know by looking at the patient chart that they have a risk for falls, for example, or they should not be prescribed a certain type of medication because of kidney disease, or a patient's on a blood thinner and they should not be prescribed an anti-inflammatory that has blood thinning qualities, because these things can lead to problems. So these are alerts that are organized in a fashion so that everybody in the facility, from the patient, from the staff member side, knows what's up. These are the little things that help to prevent error, medical error. You'll read, I'm sure, or hear in the news sometimes that, you know, wrong-sided procedures are done, wrong-sided surgeries, and so forth. Those are very scary for patients when they hear things like that. We take all precautions in order to prevent any of that from happening. And we have accountability by having the Joint Commission accreditation, because we don't want to lose that accreditation. This is a standard that we voluntarily have placed ourselves, and we want to keep up with that measure on a day-to-day.